Hello students, welcome to Good Samaritan School HPE Health and Nutrition class. Today Health and Nutrition class I will again talk about soft tissue injuries that I haven't complete in last first aid class. So today topic will be strain and sprain. Lots of people used to confuse about these two. Uh, Either sprain is a ligament injury or a muscle injury, or strain is a ligament injury or muscle injury. So today I will clearly explain what is sprain, what is strain, uh, how to prevent from that injuries and its management. Muscle injuries and ligament injuries are very common sport injuries. So most people who participate in sports have experienced it at some point in their life about these injuries. Um, so first we will talk about the muscle injuries, that is strain. So strain is a muscle injuries. So it caused by twisting or pulling a muscle or tendons. Strain can be a mild or a very severe injury. Sometimes a complete muscle used to be torn, and in that case, you are not possible to move your injured part at any cost. So, sudden or acute mild strain is caused by a recent injury like lifting heavy objects in a wrong way or rods in a wrong way. And chronic strain are usually caused by moving the muscle and tendons in repetition. When you work out or when you lift anything, if your posture is not correct, some specific muscle in your body are continuously working, and when that muscle is overused, it used to get ruptured, torn severely, and cause that chronic strain, and at that time you cannot even lift your uh, specific injury part. So overuse of muscle is very dangerous. So for the management of strain, price procedure is used. Price: P for protection, R for rest, I for ice, C for compression, and E for elevation. So P, protection. Protect the injured area of the victim from further injury by providing support to him. If he fell down in the ground, uh, protect that area so that someone might not come and bump in again. Uh, uh, Give a support to him and move aside in a safe area. So firstly, you have to protect that area. And second, so rest. R is rest. It is beneficial to have much rest as possible in the early stage in order to allow your body to heal quickly. So so avoid that temptation to move the injured area in order to see if it's still hurts. So don't try to uh, work on that muscle, like, so when you fell down, don't try to stand up to see whether it is still paining or not. So that is very dangerous. It may again cause further more injury. So a proper rest is very important. And I for ice. So ice should be applied directly on the site of the strain injury area as soon as possible. You might have seen when a player is injured in the thigh or a cramp in the calf, directly physiotherapists used to run in and put a big ice bag wrapped with a towel, a cloth, or a plastic. So it reduces the bleeding and swelling by slowing down the blood circulation inside, and it also relaxes the injured area by reducing pain. When you apply ice, your muscle get numb, and it will reduce pain. So as I said, ice should be always wrapped in a cloth or a plastic to prevent your skin burn. And C stand for compression. Compression of an injured area of your muscle, like your thigh muscle, hamstrings, your calf, bicep or triceps. So it will help when you compress in the injured area. It will help from reducing from swelling as well as bleeding. So compression should not be applied very hard, so as it may hinder the flow of blood circulation. It should be in a soft hand, wrap it with a pad or a bandage. And elevation, E for elevation. If it's possible, keep the injured leg or your hand elevated up with the help of pillow above the level of the heart to reduce the swelling. So these are the management of strain. And now we will talk about sprain. So sprain is a ligament injury. In Hindi it is abandon. It's a abandon injury. So it may occur due to overstretching or tearing of ligaments. Many things can cause sprain. When you run, you may twist and fall or getting hit. So this can cause the ligament injury. So this cause ligament around the joint to tear. Generally, sprain occur at wrist joint and your ankle joint. We used to say like mera ankle mud gaya. So this happens in sprain, your ligament injury. Sometimes even fracture is also possible along with sprain. In such injury, swelling, inflammation, severe pain are common symptoms. So for the management of sprain, two procedures are used, that is price and mice. Price I have already explained you in your muscle injuries, so I will not explain again here. In sprain management, price is used, and after that mice is used again. So once the sign of inflammation have gone and heat and redness are reduced, the mice procedure should be followed until the injury is healed. So mice stand for mobilization, ice, compression and elevation. M for mobilization, I for ice, C for compression and E for elevation. So mobilization is a type of therapy to quickly recover and regain your strength. So you have to slowly move the injured part through its full range of movement. If it is pain, you have to stop, and if you can move slowly, you have to slowly move, like increasing the range of movement gradually. So it usually takes times for the injured part to get back to its normal strength. So only light and simple exercise should be done at first. So if pain is felt during exercise, the exercise should be stopped immediately. If the pain disappeared within 20 to 30 seconds, the exercise should be continued with a proper precaution, and I should be continued for a week according to the injury. Approximately 4 to 5 days. Heat treatment such as hot pads, wax treatment, wax bath can be applied. It helps in stimulating the blood circulation to the affected area, and compression should be continued for a few days, and after that it is not required. Elevation should be done until the signs of swelling, heat and redness have disappeared. So these are the management of sprain. I hope I have clearly explained both the injuries of muscle and ligament. So thank you so much for listening to me. Have a good day. Bye bye.